lower your risk of a cancer recurrence by 59%. In this video, I'm gonna show you exactly how to do that. After following thousands of breast cancer survivors for several years, we now know that targeted exercise can reduce your risk of a cancer recurrence by up to 59%. This is a better risk reduction than a lot of medications that are designed to reduce your risk of recurrence. That's exactly why I'm gonna show you this 5-minute workout designed specifically for breast cancer survivors to lower your risk of your cancer from coming back. This is exercise for survival. The scientific evidence around this topic really exploded when I was completing my doctorate in cancer care. We now have evidence from the Nurses Health Initiative that this is a very effective way in lowering your risk of a cancer recurrence. Of course, there are still many things that we don't fully understand about cancer, so really nothing will give you a guarantee to stay cancer-free. But we do know that targeted exercise will significantly reduce your risk of cancer from coming back. I know that after my cancer diagnosis, I absolutely never wanted cancer to come back again. So I set out to do absolutely everything in my power to stay cancer-free. But here's the truth about my own personal diagnosis. Before I was diagnosed, I was already very physically active. I loved to run, I lifted weights several times a week. I was already doing all the right things, but I still got cancer. We know that cancer sometimes happens anyways. But here is the upside to my situation, and maybe yours too. Being that fit and strong before cancer actually allowed me to endure treatment and recover so much faster. It's possible that all the healthy habits and exercise actually allowed me to go from stage 3 to cancer-free 6 years counting. The most effective lifestyle strategy that you can use to prevent a cancer recurrence is exercise. Many cancer survivors mistakenly think that supplements are the secret to staying cancer-free, but that's not true. Using exercise and movement in a strategic and targeted way is the most effective way to lower your risk of recurrence. If you were not active before cancer, for example, you had a desk job, you didn't walk around a bunch, you didn't exercise after work, you can still lower your risk of a cancer recurrence if you start with targeted exercise now. We know that cancer survivors who were not active before cancer and become active after cancer can still reduce their risk of a cancer recurrence by up to 52%. Every single breast cancer survivor should be following a targeted exercise plan to reduce their risk of a cancer recurrence. But unfortunately, many cancer survivors are not supported in this way, and they simply don't know what to do and what's safe to do after cancer. That's exactly why I'm gonna walk you through some very simple but very strategic exercises to reduce your risk of a breast cancer recurrence. These movements are also very safe. These are movements that just use your body weight, that's it. So the risk of injury is really low. You don't need any equipment to do these movements. Plus, these exercises are also very simple to learn. If you've never done any strength training or resistance training, this is where you should start. A breast cancer thriver that I work with in the Cancer Freedom Program had never done any strength training before in her life. She really described herself as a cardio bunny. She loved to run, and she only spent time in the gym on the elliptical, treadmill, or rower. She was really anxious about getting started with strength training. She also didn't want to get too bulky and muscly. It made her really anxious to try to do any kind of strength training at the gym. It was like everyone was watching her. She just really felt uncertain about how to do these movements. On top of all of this, she just could not find the motivation to get back to working out. She knew it was important, but she just could not get started. She definitely did not want to try figure out a new exercise routine. She did not have the motivation for that. So we walked through these exact movements I'm gonna show you. She now works out 4 days a week, and she's confident lifting weights. So let's get started with this 5-minute workout to help stop your breast cancer from coming back. Start with this first movement, bodyweight squats. Squats are a great exercise to prevent a cancer recurrence. We want movements that will work all the major muscle groups in your body, and squats will do exactly that. During a bodyweight squat movement, you actually need to use your legs, your glutes, and your core to stabilize yourself. Let me show you how to do a bodyweight squat safely and properly. If you're finding that you're having a hard time with your balance, it's completely completely fine to hang on to the back of a chair or to a wall to help stabilize yourself. Eventually, with time and practice, you'll be able to complete this movement without holding on to anything. And don't worry, you'll still get the exact same benefit if you hold on to something to stabilize yourself. We're starting this movement with your hips. Start by driving your hips or your butt backwards and then descend down. You'll want to continue to descend down until your butt is lower than your knee. Now, when you're completing this movement, you'll want to make sure you do this in a slow and controlled way. That's exactly what makes this ideal for cancer survivors and works your muscles the most effectively. Do this movement in a slow and controlled way to prevent any injury and also to help you stay strong and healthy. I want you to do 15 bodyweight squats here. Many people believe the bodyweight squat only works your legs, but that's not true. It's actually a full body movement. This movement will work your legs, your butt, your core. We're really using your core to stabilize yourself during this movement. Now, we need to be particular about which movements we select in order to actually reduce your risk of a cancer recurrence. The type of movement that you're doing really matters in terms of lowering your risk of recurrence. We want to work out all the major muscle groups during your workout. Your legs, your arms, your core, your glute. Let's move on to another movement that works a lot of the major muscle groups. Next up is the walking lunge. The walking lunge, again, is going to focus on the legs, the glutes, and the core, which makes it a perfect exercise to lower your risk of recurrence. Same with the squat. You can use the back of a chair or a counter or a wall to help stabilize yourself during this movement. What we want to do is step forward here. Hands on your hips or out to the side for stability. Lower your back knee down until hovering just above the floor or touching the floor. Then step back up. Continue this movement in a slow and controlled way. And I want you to complete 8 lunges on each leg or 16 in total. Now, let's move on to another movement that really focuses on arm strength, but again, is going to work out your entire body. A body weight plank is a great movement to work out your arms, your core, your glute, and it's also very simple to complete. If you're struggling with belly fat after cancer, this is also a great movement to focus on. After cancer treatment, many women are in forced menopause or medical menopause. As a result, you start to carry fat tissue in different areas of your body because of the hormonal imbalances. The result is often belly fat, which is actually the most dangerous fat in terms of your overall health. Of course, nutrition plays a big part in this, but focusing on strengthening your core muscles will help to improve that belly fat. Ideally, we want to work our way up to doing a full plank from your feet. But the key here is that we want to work up to this. There's a number of ways we can modify this movement. Start at your knees and hold this movement for a very short amount of time. Even if you start with just holding this movement for 10 seconds long, you'll be doing good work and still lowering your risk of a cancer recurrence. Ideally, I want you to work up to holding your plank for at least 30 seconds. Now, let's focus on your arm. A lot of breast cancer survivors are told that they'll never be able to do another push-up after their mastectomy. This is completely untrue. This is a fixed mindset barrier that's pushed onto a lot of breast cancer survivors, but it absolutely doesn't need to be like this. So we're gonna start breaking down this barrier right now. Let's start with a very simple and straightforward variety of a push-up. A push-up to a wall. Taking away the majority of your body weight from this movement makes it much simpler and much easier to complete. The further out you place your feet from the wall, the more difficult this movement will become. If you find that doing push-ups to a wall is too easy, then progress to doing push-ups to the back of a chair or the back of a couch. Then eventually you can progress to push-ups from the knee and push-ups from your feet. Again, you're gonna wanna make sure you're stabilizing your core when you're completing this movement in order to get the full benefit. Whatever variation of this movement you choose to complete here, I want you to do it 10 times. Okay, but we need to include another movement here that also focuses on your arm, but different muscles in your arm. Dips. This is one of my favorite exercises for breast cancer survivors because it works on your triceps and leads to great muscle definition. This is what will have you looking lean and toned after cancer. Find a chair, a table, or a couch where you can complete this movement from. You'll want to slowly lower yourself to the ground. Now, the further you lower yourself down, the more difficult this movement will be. We're using a large range of motion here as well. I want you to complete 10 dips here. Okay, but here's the truth about exercise after cancer. We know that this is the most effective way in preventing your cancer from coming back, but we do need to pair it with the right foods. It's actually food that's gonna allow you to get the most benefit out of these workouts. You're putting in the time and the effort to learn and complete these movements, then I wanna make sure you're getting the most benefit out of them. That's exactly why I've linked up this next video here. This next video is really gonna set you up for success. I'll see you in there.